my name is Laura Cheryl. I'm going to do a speech on stem cell research. But first off, I'm going to read you a story that was derived from one of the success stories that we've had so far with stem cell replacements. So just bear with me here. Physicians at the University of Minnesota and the University of Minnesota Children's Hospital in Fairview believe that they are on a path for a cure for Nate Leo, a 25-month-old from Clarksburg, New Jersey. Nate has a fatal genetic skin disease called RDEB. Children with RDEB have skin that is exquisitely delicate. The skin and lining of their gastrointestinal tract is fragile. Tearing and blistering occur with minimal friction. Those affected must have their entire body wrapped with bandages. Those who do not succumb from malnutrition and infection in childhood will acquire a uniformly fatal, aggressive cancer of the skin in young adulthood. Nate Leo received marrow and umbilical cord blood derived from stem cells and progenitor cells from his healthy tissue-matched donor brother. Over the next 6 months, the skin and lining of his gastrointestinal tract were slowly improved, and skin biopsies on days 60, 130, and 200 documented increasing amounts of collagen type 7. By day 130, Nate's skin and the lining of his gastrointestinal tract were beginning to show clinical signs of improvement. Based on the success seen with the treating Nate, Wagner will enroll additional patients into his clinical trial study. Okay, stem cell research is one of the most controversial subjects of today. A lot of the controversy is derived from the embryonic stem cells. There's two different types though. You can have adult stem cells and you can have embryonic stem cells. The reason why we like embryonic stem cells is because they're so not specialized in what they can do. They can do just about anything. You can put them in your pancreas, in your liver. You can use them to treat cancers. You can use them to treat burns, and they will cure those. Adult stem cells, on the other hand, can only cure a very few specific problems in the body. The controversy, however, though, comes from using aborted fetuses in embryonic stem cells and using the leftover eggs from IVF. I believe, though, to avoid the controversy, that we should take out the leftover eggs from IVF, because personally I do think that's still alive. When the sperm and that woman's whatever eggs meet, I believe it's alive at that point. And so in that opinion, I think it should be thrown out altogether. And then another thing is, people believe that women would come and continually abort babies for the money. I don't think mothers should be paid for these stem cells. I think if they do it, it should be out of the goodness of their heart. It should be because they want to help save other people. And we're also learning ways that we can make our adult stem cells more versatile is what they can do. But in order to do that, we're going to have to study both. So maybe in the future we can rule out the embryonic stem cells altogether and just use adult stem cells, but we'll have to study these embryonic first. You can get embryonic stem cells from naturally aborted fetuses. So when there's a problem during the gestational period, I think that would be fine. You can just, with the mother's consent, you take that fetus and take the stem cells and use it and study them, and maybe we can learn more about the adult stem cells and how we can change and use those to treat other people. With that thought, I believe that if you or your loved one had a 2-year-old, what if that was your 2-year-old, and the only thing they could do for it was to try to replace it, stem cells with these stem cells, and cure your child? You would be ready to try. You would be desperate for a cure. I know I would, and I know any mother would want to save their little child. So I believe that supporting stem cell research today can make a huge difference in everyone's life tomorrow. The end.